Thanks for joining us to learn Hands-Only CPR. What you'll learn today is an effective and science-based approach to saving a life. While this video is not a certification, we recommend this training for families and friends of somebody with heart disease or risk factors or a history of a heart attack. We also recommend it as a standard part of annual workplace safety training.
In Mesa County, our 911 dispatchers teach CPR over the phone about once every 3 days. But learning over the phone during an emergency can be tough. This video is a chance for you to practice those skills before you ever have to use them.
Heart disease is the leading cause of death in the U.S., and it's a risk factor for sudden cardiac arrest. Other risk factors include previous heart attacks, coronary artery disease, high blood pressure. High cholesterol, obesity, and diabetes are other risk factors.
Cardiac arrest happens when the electrical signals of the heart are disrupted, causing a sudden loss of heart function, breathing, and consciousness.
In Mesa County, 70 to 80% of cardiac arrests happen at home. That means you are most likely to offer CPR to a friend or family member. So today, learn Hands-Only CPR for the people you love.
Hands-Only CPR can double or even triple chances of survival. Trying to help is always the best option. In a cardiac arrest situation, some CPR is better than no CPR.
The methods taught in this video are appropriate for teens and adults. We'll practice twice. First, how to give hands-only CPR if you're alone, and second, how to give hands-only CPR if there are others around to help.
You can practice on a firm pillow, a rolled up bath towel, a soft plastic bottle with the cap on, or a roll of toilet paper. Let's get to it.
A person having a cardiac arrest will lose consciousness quickly, causing them to collapse and stop breathing. If you see this happen, or if you find somebody unconscious, remember, check, call, and then provide care in that order. You can follow along at home.
Consider your personal safety before attempting to help another. If for any reason you feel you are putting yourself in danger, wait for help to arrive. First, check the person by tapping on them and loudly asking, "Are you okay? Are you okay?" If you get no response, call 911. If you're alone, put your phone on speaker mode and set it in front of you.
Answer the questions of the dispatcher. Remember, we will walk you through this. And don't hang up until your dispatcher tells you to.
To give the right care, the first thing we will have you do is look for breathing. If they're breathing, your dispatcher will give you instructions on what to do next.
However, if they are not breathing or not breathing normally, this means their heart has stopped or is about to. So you'll begin CPR.
You'll need to get the person on a firm surface to effectively squeeze the heart with each chest compression.
To give effective chest compressions, you're going to push hard and fast on the center of the chest.
Let's go ahead and find the center of your chest by placing your hand under your armpit and sliding the heel of your hand over until you feel your breastbone. This is where you'll push while giving CPR.
Place the heel of your hand on the center of their chest and interlace your fingers. Move to a tabletop position and use the weight of your body with straightened arms to push to a depth of 2 inches. After each compression, let the chest rise back up completely.
Now let's talk about how fast to push. You'll aim for 100 to 120 beats per minute. There are some songs to help you remember how fast to push, like Staying Alive, Uptown Funk, and Baby Shark. Keep pushing hard and fast on the center of the chest until emergency responders arrive. If you want to pause the video here, we encourage you to set a timer and practice chest compressions for at least 1 minute.
When someone's heart stops beating, their blood stops moving. That means critical organs like their brain are no longer receiving oxygen and cells will begin to die. If someone is without a heartbeat or CPR for more than 4 minutes, brain damage begins to occur.
On average, when you call 911, it will be between 6 and 10 minutes before emergency responders arrive. This is why fast and effective CPR is critical.
By pushing hard and fast on the center of the chest, you're physically squeezing the heart like a sponge when you push down. When the chest comes all the way up between compressions, the heart refills with blood before the next squeeze. This motion circulates blood and oxygen to the organs to keep them healthy and receptive to the medications and the AED that will soon arrive in the ambulance to help restart their heart.
Speaking of AEDs, automated external defibrillators, if you are providing CPR in a public space like an airport, mall, or school, call for someone to bring you the AED. AEDs work with CPR to restart the heart using an electric shock. When an AED arrives, simply turn the machine on and a voice will walk you through how to use the device.
Unit okay. Stay calm. Check responsiveness. Call for help. Attach defib pads to patient's bare chest.
The pads must go on the skin, and occasionally the machine will tell you to stop compressions and stand clear of the person. Simply follow the prompts until help arrives.
We're going to practice one more time, remembering to check, call, and provide care in that order. The only thing that's different is this time, we're going to pretend you're in a public place with other people around that can help. Follow along with whatever you're choosing to practice on.
Let's pretend we find a person unconscious in a building. We're first going to check by tapping on the shoulder and asking loudly, "Are you okay? Are you okay?"
They don't respond, so the next step is to call. But we've got people around that can help. Point to someone. Ask them to call 911 and stay with you. Point to someone else and ask them to bring you an AED since you're in a public place.
Begin providing care by checking to see if the person is breathing. Remember that if they are, stay with them, and dispatch will give you further instructions. But if they aren't, it's time to start CPR.
We're going to push hard and fast on the center of the chest. Push 2 inches deep, 100 to 120 beats per minute. Now, if you've practiced for a minute in the first round, you know CPR is physical. So with people around to help, it's okay to ask for help. In fact, professionals tend to switch compressions with another person every minute or two.
Just be sure to communicate and try not to miss a beat. I'm getting tired. Can you help out? Yes, just tell me what to do. I'm gonna count down. You'll put your hands where mine are and push hard and fast in the center of the chest. Okay, 5, 4, 3, 2, 1. You can trade back and forth like this until help arrives.
Again, go ahead and pause the video and practice all the way through, checking for breathing, asking people to call 911 and get the AED, and practicing handing over chest compressions to another person.
It's important to know that CPR doesn't often happen like in the movies. The person may not sit up and gasp for air or cough, but you may see their color improve. Your 911 dispatcher will coach you through, and remember, any CPR is better than no CPR.
Ideally, keep giving CPR until help arrives. But if you become too tired or begin experiencing chest pain or shortness of breath yourself, please stop.
If the person becomes alert, begins breathing on their own, or starts to move on their own, pause compressions and check for breathing again. If breathing stops at any point, resume CPR.
The breastbone where you are pushing connects to the ribs with cartilage. When you push, you may hear pops like cracking your knuckles or your back. It is possible to damage ribs, but it's unlikely these will cause injury to the lungs or heart.
All of this is normal, and if you feel or hear these noises, it's okay. Keep giving CPR until help arrives. Cracked ribs are survivable, and any CPR is better than no CPR to help this person survive cardiac arrest.
Thank you for taking the time to learn and practice today.